My name's Carroll. I'm a physiotherapist that works here at the Petersfield Physiotherapy and Sports Injury Clinic. I'm going to talk to you today just about posture. It's quite a big thing these days given our sedentary lifestyles and that we don't move around quite as much. So one of the things that I hear from people a lot is that, oh well, I always thought I stood up straight, but quite often there's a generation of people there who are always told to throw their shoulders back and stand up straight, but really what you're doing is throwing your shoulders back and your hips forward, so you can end up just resting in this position here, which eventually will get a bit sore if you're there quite a lot. So again, what we want to be is in somewhere in the middle, so we don't want to be slouched over like this, but we don't want to be fully extended through here, and we want to be somewhere in the middle. So one of the main things with posture is that it's not necessarily a bad thing to be slouched over or fully extended like that, but it's not good to stay in it. So if we're in these positions when we drive, when we use a desk, or if we have our shoulders back like this, that's not a bad thing either, but it is a problem if we start staying in those positions. So we need to be able to get to them, but we need to be able to get back out of them as well. So if we do have to stay in a position like at our desk or driving, there are certain things we can do to try and help with that. So to try and prevent aches and pains and allow us to stay there for a bit longer. So the main thing what we can try and do is, if we think about contracting our backside muscles here, it gives us a nice stable pelvis to work off. And then with our shoulders, just keeping in line where they are. So sometimes we find we might be in this position because we've been driving or using a keyboard, iPads, phones, those sort of things. So one of the things to prompt you out of it is if you imagine gripping onto a bar and pulling it towards you like this, and then let your hands fall down. So then you've got a nice neutral posture there that you can go and sit down, stand up, talk to someone. If you have to stand all day, you don't want to be sitting in that position because we could stand there all day, but you're going to get a little bit achy from it. Okay, so if we bring Beatrice in here just to show us, so we can see from Beatrice that she could be a little bit better with her shoulders and with her hips. So if we prompt Beatrice to, if you contract your backside muscle, so clench your bum. Okay, so from that position, if you either think about squeezing your shoulder blades back like this, or if we got you to imagine gripping hold of a bar and pulling it towards you, so keeping your elbow straight and pull it towards you like that, and then just let your hands drop, and then you've got a nice neutral posture through your hips, through your shoulders. And the next thing you can work on is through your neck. So what we don't want to do is get caught in this position here. So we want to put your head back on your shoulders by tucking your chin back this way. Okay, so, and relax. So that may feel quite odd to you, but that is what you should be on a day-to-day basis when you're either sitting watching TV, using your computer, or driving. Okay, so if I just get you to relax there and just sit as you normally would, Beatrice. So what we can see is that Beatrice wants to lapse down into this flex position, so which is fine, you know, if we're going to stay there for a few seconds. But if you're going to watch TV or do some desk work or just sitting for a long period like that, it's not ideal. So what we want to do is get Beatrice to sit up a bit taller. That's it. And if you squeeze your shoulder blades together for me and relax, and if you slump your shoulders forward like that and come back. So where we want to be is somewhere in the middle. Okay, so you don't want them all the way back like this, but you don't want to be all the way forwards either. So just back in the middle there. Okay, and again, if we're going to look at the neck as well, quite often we get caught in these sort of positions, or if our screen height at our desk is too high, we have to do this a lot, which is essentially like looking up in the sky all the time. So to correct that, what we want to do is just get you to tuck your chin straight back this way. So come back up. So if you imagine keeping this bit here, but just tucking your chin back, that's it, perfect. So it probably feels quite odd. Okay, and relax. Okay, so that's your position. So that's what you're going to do when you go home this evening and sit at your desk or sit at your computer. So if you'd like to know more about posture and if we can help you with your posture, if you give us a call in the clinic on 01730 267 645 or get in touch through our website on www.ppasic.co.uk.